We have an enormous challenge. Today we have about 45 million Medicare beneficiaries. That number over the next decade will grow to more than 70 million. In order to make the system affordable, to provide the right care to these patients in the right setting, we have to become much more effective and efficient. Technology has to play a role to help our reach, our efficiency, and frankly, to help improve outcomes, because you can't physically see every individual every day.
The patients that are involved in this program range anywhere from early 50s all the way up to late 80s. And they've all been diagnosed with congestive heart failure. Most acute patients, critically ill patients, need extra TLC, if you will.
My concerns with Ron's health is overwhelming. It's a lot of anxiety, scary, not knowing from day to day how he will be.
I have a care manager who pretty much checks my daily weight and blood pressure. And Judith is a very, very good friend.
Oh, I'm fine.
Before I got the Intel guide, I had to take my own blood pressure, and it would come up with ridiculously high numbers. I would get this anxious feeling, and the anxious feeling would just raise the blood pressure even more. And now, I don't have that problem anymore. I take my blood pressure, Judith checks it, she's happy with it, I'm happy with it, and we just move on.
Thank you.
It's a great feeling.
Coming from a critical care setting and then going into a case management setting where it's all mostly telephonic and some home visits, it's really hard to assess a patient when you cannot see them. You have to see them.
I'm just calling because
now with the Intel system, I'm able to see the whole picture. I'm able to see 7 days of their blood pressure. If it's too high for 2 days, then we give them a call. Then I find out exactly what's going on. If the weight is dropping, find out if their medication needs to be adjusted. I have all access to doing that.
It's like having a doctor living in my house 24 hours a day, helping me take care of myself and helping me keep myself healthy.
It's really helped us through lots of rough days. So we know how he's doing daily, so we don't have to panic and rush into the doctor or the emergency room for treatment. So it's a tremendous help to us. It gives us a little relaxation, it's kind of giving us a breath of fresh air.
The pilot has been extremely successful. I think there's probably 2 or maybe 3 ways that the health guide has been valuable to patients. 1, it's engaged them in the process of their own health care. 2, we believe that it will improve outcomes. Nobody wants to go make a trip to the emergency room in the middle of the night, and by intervening early and appropriate, we believe that we can change some of those outcomes. The 3rd way that it is engaged the patients is it's given them comfort that they have 24-hour connection to a caregiver, to a knowledgeable caregiver. Can we build it to scale across our population? That's what we'll find out next. Part of our mission is to make sure that they get the right care in the right setting at the right time, and especially allowing them to remain independent in a residential setting of their choosing. That's our mission. This is our passion. And this tool allows us to take one more step into fulfilling that mission.